Brian Brandman is UMC's new CEO. He's been a part of the UMC family for years now as our COO, and now he has stepped into a new role to help lead UMC on the path to becoming a true academic medical center and the community's choice here in Southern Nevada. UMC has been in Southern Nevada since 1931. We have deep roots here and a mission to take care of those who need us and those who need the higher level of care and treatment that is unique to UMC as the community's public hospital.
And those are the things we're most known for, but they are, and frequently those are the types of services you only find at a public hospital or a safety net hospital, anywhere you look in the country, whether you're in Los Angeles or any of those cities I mentioned. Those, trauma centers, burn centers, pediatric intensive care units, are frequently found in those sorts of facilities because they have the critical mass of specialties there to provide it. They're like we are affiliated with a medical school, and so you've got residents and other very expert staff to run those organizations, and you get good at taking care of extremely complex, very sick patients. And we do it well, we get good outcomes.
We admit we're not the prettiest hospital in town, but marbled floors won't be the thing to save your life if you're in a car crash, need a kidney transplant, or have been severely burned.
But we're not flashy. We don't. I don't give you roses and a lobster tail with your with your meal in the evening, but we'll guarantee you get good care, and that's what really the most important thing is. This isn't a resort; it's a healthcare facility, and we do a great job.
UMC makes headlines quite often for our budget deficit, but the reality is UMC does about $250 million in uncompensated care every year. Those are folks who are in desperate need of our services, and we generate enough revenue to offset most of that shortfall, with the county subsidy being about $70 million. As CEO, Brian knows one of his responsibilities is to continue to cut costs and improve revenue.
Healthcare is expensive. But we don't want it to be too expensive. It shouldn't cost too much, and we shouldn't spend one nickel more than we have to get the kinds of outcomes we want. And so you've got to be good stewards of the dollar. We don't want to be wasteful. Quality of care is less expensive, so you avoid things like readmissions, unnecessary infections. Those are all things that are integral to what we're trying to do here with healthcare. So that at the end of the day, the taxpayers know that we do a substantial mission for the community. But we're not just wasting the resources.
And that remains a delicate balance.
Our payer mix, some of it's due to the neighborhood we're located in, some of it's due to our mission. You can't, folks show up from an auto accident, popped out of a helicopter, who knows what their insurance status is, and that isn't the first priority. It's to save their life and to preserve limbs and so forth, and so that's the first priority. But then it may turn out these folks who have hundreds of thousands of dollars worth of charges don't have a means to pay in it.
As Nevada's only Level 1 trauma center, the state's only burn care and transplant center, Southern Nevadans depend on UMC for life-saving care, the kind of care we are very proud to offer our community.
And healthcare is, fundamentally, it's people taking care of other people. So while we use a lot of high technology, at the end of the day, it's how you take care of your folks.